Are you a L.I.V.E teacher? L.I.V.E teachers not only think outside of the box, they break the box.
Are you a L.I.V.E teacher? A L.I.V.E teacher is someone who never stops learning.
We know that highly efficacious, efficient, and effective educators expect their students to succeed.
Yes, y'all. Watch out!
L.I.V.E, highly efficacious, effective, and efficient educators, is a series of 22 live lessons that focus on different areas of teacher efficacy, advocacy, and support.
L.I.V.E teacher brings fun into the classroom.
L.I.V.E teachers bring excitement to the classroom.
They welcome change into their classroom. They are masters of the subject and the content that they teach. And most importantly, they never stop learning. So again, I ask, are you a L.I.V.E teacher?
We're excited that you can join us and stay tuned for our upcoming L.I.V.E lessons, and we look forward to learning and growing with you. Thank you.
Yeah, come on. I like that, y'all. The H, the E, the H, the H, the E, the H, the E, the H, the H, the E, I like that, like that. The H, the E, H, E, H, E, Heck yeah. Yes, y'all. Watch out. H-E-N.
Good evening, everyone. Hello. Good evening. I am Keisha Wiley, bringing you greetings from Dallas, Texas. Welcome to the L.I.V.E Summer Learning Series, where our goal is to inform, empower, and encourage educators, families, and all of those who hold the stake in education Whether this is your first time joining us or you have attended other sessions, we want to thank you right now. Thank you for your presence. Thank you for your participation. We're going to continue to learn and grow as we have for the past 10 weeks. Tell us where you're watching us from. Chat room, get in the chat box in the comments. Let us know. Hello to those who are watching us from Atlanta, Ohio, Tennessee, Florida, California. Hello, everyone. Isis, tag your it.
Good evening, everyone. I'm Isis Spain, bringing you greetings from Moncks Corner, South Carolina. Hope that everyone is doing well and that you enjoy our session on tonight. Tag, Miss Levels, you are it.
Hey everybody, I'm Lavetta Levels. I'm coming from Dallas, Texas. So glad to see everyone here. I see Shalonda Soroya is here from Atlanta. Hey, and all of our other regular people. To see everyone here. Thank you. We see you, Robin Stewart from Stonecrest, Georgia. So please tell us where you're watching from. New Orleans, I see you. Make sure you share the video. Tonight is a phenomenal night. Make sure you share with your co-workers, your family, your friends, because we want to make sure that the information shared tonight, that it goes across the world. Tag Seminary, you're in.
Hey everybody, how's everybody doing today? You already know I'm from the great state of North Carolina, but I bring you guys from College Park, Maryland tonight, and I'm excited that I get to introduce Dr. Regina Moss, who did a little work in the University of Maryland at College Park. So, hey, Miss Dorothy Staten, I see you from Greensboro, North Carolina. We have Barcelona in the house. Now we are international. This is international He-Live show now. Hey, Barcelona. So, Miss Dr. Regina Davis Moss. She is the Associate Executive Director of the American Public Health Association. She oversees a broad portfolio of programs addressing the social detriments of health and has nearly 20 years of experience managing national health promotion initiatives addressing women's health, health equity, and public health system capacity building. Formerly, Dr. Davis Moss held a senior management position for an obesity prevention effort for the National Institute of Health. Prior to that, she worked for the Kaiser Family Foundation, where she helped launch the Kaiser Health News online information service and served as a senior producer. Dr. Davis Moss came to Kaiser after serving as a supervisor for the epidemiologic, so I'm working on my reading skills tonight, study focused on women's reproductive health. She also served as a public health service fellow in the Office on Women's Health for the U.S. Department of Health and Human Services. Dr. Davis Moss earned a PhD in maternal and child health from the University of Maryland, College Park, MPH from George Washington University, and a BS from Howard University. And so we would like to welcome Dr. Regina Moss to He-Live.
Thank you. So happy to be here.
Thank you so much for being here. We look forward to your presentation. And so we're going to get out the way and let you share with us tonight how to have equity in health.
Great. So like I said, it's a pleasure to talk to you today. I'm going to go ahead and get started. Are my slides up? Great. So I'm going to be talking to you about the connection between education and health and why it's so important. A high school diploma is a leading indicator of health, so much so that graduating from high school in 4 years is a public health priority, and it's a goal of the Surgeon General. So I'm going to start by giving you a little bit of background, what we've learned, strategies to address some common issues, and then some programs that we're working on. Next slide, please. So here we just talk about health and school success. And basically this is just to say that these are two sides, health and school success are two sides of the same coin. One simply they cannot happen without the other. It just can't. So you can't learn, a student cannot learn if they're not feeling their best physically or emotionally, or think about it when you're not feeling well, you really don't feel like doing much of anything, right? Next slide, please. So that might seem obvious, but I want to show this slide to show that this is actually supported by data. So here in this chart, we see there's a direct correlation between years of educational attainment and death. So the fewer years of education, the greater likelihood of early death. And so the reasons for this are complex, but they include things like poverty, being unemployed or underemployed, lack of access to healthcare, and less opportunity to learn about and to begin implementing healthy behaviors. We also know that education, having a high school diploma, increases your ability to earn a livable wage and the ability for you to be able to purchase healthcare or to be employed with an employer that offers healthcare. So all of these things come together, as well as some of the things I'm going to be talking about in a moment, to contribute to health. And then we just know, by contrast, students who drop out of high school are more likely to die at younger ages, as adults are, from chronic conditions such as heart disease, cancer, infections, lung disease, diabetes, than their peers who actually graduate. So this next slide, please. So this next slide, you can't see it, but I'm going to read what's in those circles. But basically, it's just, again, showing that we know that when kids are dropping out of school, it's really for the same reasons that they're put them in poor health to begin with, not only as youth, but also what's going to put them in poor health as adults. So those include things like homelessness, chronic stress, or trauma. But there's also disadvantage, or what we like to call it, being from a low socioeconomic status or in a marginalized community. And so this slide was going to show you a study by Charles Bash, and where he identified 7 educationally relevant health disparities that have their roots in this disadvantage that I talked about that contribute to poor high school dropouts. So that's lack of physical activity, pregnancy, which is really the most prevalent reason that girls drop out of school, hunger, from not only from just not eating breakfast, but just hunger in general, unmanaged asthma, undetected vision problems, behavior issues related to hyperactivity or inattention, and exposure to an exhibition of aggressive or violent behavior. Next slide, please. So this slide illustrates the causal pathway to dropout. So this basically just shows you how this is happening and how these health disparities have an impact. And so they have an impact on either the perception, the cognition, the school connectedness, or attendance. So for example, all of these problems have a root influence, like I said, in disadvantage or social circumstances, and they impact neurocognitive functioning, which in turn influences disengagement from school, a limited feeling of school connectedness, which is going to influence attendance, which is going to influence the ability to opportunity to be taught, which is going to influence performance, and then that's how the pathway begins. And then add that in to a variety of adverse childhood experiences, or ACEs as we like to call them, that can also interfere with attachments, not only with teachers, but other caring adults or even peers. And then you see students looking for other intimate attachments in other places, which can lead to risky sexual activity, joining gangs, or even self-medicating with drugs and alcohol. And we're seeing this as early as elementary school, and we're seeing behaviors such as hyperactivity, aggression, and violence, as you've seen in a lot of reports happening even in pre-K and kindergarten. Next slide, please. And so this slide just demonstrates that Black, Latinx students with disabilities, students of low income, and English language learners experience greater lags in graduation rates when they're compared to white students. Next slide. And here's one of my favorite slides. And so this is a graphic that the American Public Health Association created in our Center for School, Health, and Education. And I always like to point out there's a comment between school and health. It's not school health like your nurse's office, but it is understanding that all 3 of those have to work together. And basically we call it the chaotic hallway. And it really is just meant to show that these are all the things that students are bringing to school before they even get into the classroom. But it's also meant to point out that health and education are closely linked. And, it would seem, if we understand this now, hopefully I've convinced you that we should be focusing more upstream and then really tackling all those institutional inequities that I've talked about and trying to meet those basic needs if we really want to have kids to have a full opportunity and achieve their full potential. And so you as L.I.V.E educators, you know this, right? There's a study that says about 91% of educators have spent their own money on supplies. 54% have used their own money to help feed students. About 20% of their time has been used helping students address problems outside of the classroom. So again, we want to try to move more upstream to try to help address some of these needs. And I'm going to talk to you about a program like ours, where we're partnering with education communities to help do that. Next slide, please. So the American Public Health Association works with school-based health centers, and there's about roughly about 2,000 of them across the country. And I'm just using this example, but I want to say that you do not have to have a school-based health center to do this work. But we started by working with school-based health centers because, number one, they're located on school grounds, either specifically inside the school or on the property. They're staffed by providers that already have experience working with adolescents and also understand adolescent development. And we know that they can play a significant role. However, as the slide says, they can reach those harder to reach populations, and they can do those early interventions, but they're only as effective as the students come into this clinic, right? So they're really there to provide that secondary level of prevention, which is when we know something's wrong and they're coming in to get it addressed. But we want to go outside of the clinic and try to stop them from having to go to the clinic in the first place, as well as try to have the most, because that's where we know we can have the most impact. And so this begins with school-based health centers, not only working with school administrators, but also both of them being more deliberate with engaging in the community and others. Next slide, please. So for the past 5 years, our Center for School Health and Education has provided capacity building assistance and technical assistance to 14 schools across the country. They range anywhere from, and this is just not urban schools, we have been in Denver, Connecticut, Nebraska, in addition to places like California, Florida. And basically what we do is we work to increase attendance, decrease disciplinary action, improve housing and food security issues, improve the school climate overall, and ultimately that's going to increase on-time graduation. And we do this through a number of things. We do it through clinical interventions, like I said, but our main focus is preventing them from going there in the first place, and then changing those policies and practices that have an impact. So I said all that. I like to just tell stories because I think that helps illustrate what I'm trying to say. So Kim arrives to school late and she's not in uniform. She walks in, she's greeted by a metal detector and that she has to walk through every day, and a school resource officer who, upon entering the building, yells at Kim for not being in uniform and that she's late, and he tries to escort her to the principal's office. Kim is not having a good day, so she yells, "Don't touch me." And the school resource officer they get into a little altercation and she begins to walk away. By this time, the other students are crowding around. They begin to take out their cell phones, as they do in this population, and it starts to become a bigger thing. And before Kim can even react, the school resource officer slams her to the floor, and she's lying there on the floor, humiliated and in pain. Next slide, please. Now, I'm going to pause for a moment and ask you what you would do. So put in the chat your choice, A, B, C, D, or E. Would you send Kim to the principal's office? Would you reprimand Kim and give her a red flag against her attendance record? Would you suspend Kim? Would you ask Kim why she's late? Or would you send Kim to class with a late pass because school's already started? So I'll give you a moment. Okay. All right, so I can't see all the chat, but I'm going to just, in the interest of time, keep moving on. But let's pick up the story. Okay, so minutes later, the principal intervenes. He brings Kim into her office. Well, let's say she brings Kim into her office, and she learns that Kim has been couch surfing, and that she doesn't have stable housing. She doesn't have electricity. She doesn't have running water to wash her clothes, let alone her uniform, because her mother was evicted because she was not able to keep a job due to her substance abuse disorder. She also learns that Kim had worn her uniform the other day, but she got teased because her clothes were smelling. And so she decided not to wear them again. So let me ask you that question again. What would you do? Next slide, please. Next slide, please. Okay, and so hopefully what you took away from this is that there are a number of things that we can do to help address this issue. And these are some of the approaches that we use. So let me first start off by saying we need to remove school resource officers. You know, I find it really disheartening that so many schools are under-resourced, but they're highly resourced when it comes to school resource officers. So we need to start thinking about things like that. And I know there's a lot of advocates on this call, and that's an area you might want to think about trying to be more vocal about. Because what's going to happen, right? Usually when a school resource officer gets involved, it usually results in her being sent to a juvenile facility, being detained all day and missing school, and then likely having an arrest on her record. If the schools were resourced more equitably, we could get into things like some of these things that I'm going to talk about. But before I do that, I do want to say this. I want to be clear that I'm not saying at all that Kim should not have been held accountable. We always want to hold students accountable, but we have to hold them reasonably accountable for their behaviors. And remember that we're the adults, and it's our responsibility to help them develop a sense of accountability, and that they have to consider the circumstance, to consider the circumstances and help them understand the impact the behavior has on what they're doing. So what I'm advocating for is, instead of a zero tolerance approach all the time, that we move to things that are more restorative. So in Kim's situation, what hopefully you learn is that what appears on the surface is, her acting out, her anger, her aggression, her being tardy, to name a few of the things, is only symptomatic of what's really going on with her. And through our program, we use a multi-tiered, evidence-based, and equity-focused framework to try to identify and respond to some of those things, and hopefully help Kim become more engaged and stop her from a process from dropping out. So for our broadest impact, our strategic approach operates at these levels on the left, and it includes things like working with school personnel or any youth serving professionals, working with students at the individual level, working with students at the school-wide level, in policies and practices within or outside the school district or surrounding community for a system level impact. And what we've learned is that the reasons for dropout are the same reasons that our young people are unhealthy. And so what we would probably do, and what we have worked with some schools to do, is we would send Kim to a cool down room. I wish I had included a slide. We have actually a picture of a cool down room where there are rules there. She can't go in there and be destructive, but it's a place for her to de-escalate, just to try to, before they intervene. And then the principal would go in, would ask her what's going on. Or if the principal doesn't have time, maybe there's a trained peer jury to discuss the broken rules, how to repair harm, maybe even a trained peer mediator or support staff that could do that. And then we work at that level to try to determine her discipline. For a school and a personnel or school-wide approach, we would have the teachers at the front of the school instead of the school resource officers. So when Kim is entering, she's seeing a familiar face. We would create food or clothing pantry so that Kim could go get food and clothing. We would destigmatize hunger. So we would offer granola bars or fruit, and those these are things that we have done. We have placed them next to the metal detectors. So when kids walk in, they can grab that and that, grab as many as they need. We've also worked with schools to provide washers and dryers. We've put security guards by showers so students can shower. We've met with, we would also want to have school counselors provide Kim with problem-solving skills, self-control skills. We might also try to identify some resources for Kim and her mother, maybe it's some skills development or vocational skills, because ultimately we want to try to intervene on this cycle. And then at a systems-wide approach, we could, as a community, either work with at the school district or advocate for, let's review some of our school discipline policies, or provide some recommendations related to child adolescent development, stress, trauma, advocate for an in-school suspension so that she's not losing instruction time, or advocate for policies that increase more shared decision-making with students. Because if we empower students, students like structure. We already know this. If we empower students and make them more engaged in this process, we can see more buy-in and we can see more the impact that we hope. Next slide, please. And so, I want to acknowledge that basically what I talked about, there's a lot of names for this type of work. So some call it trauma sensitive, some call it restorative practices. But in either case, there are these basic tenets, which is that it's a multi-tiered approach. It's grounded in relationships. It's focused on ensuring emotional and physical safety, because if students don't feel safe, they're not going to trust, they're not going to open up, they're not going to be open to learning. And then it, most importantly, considers the context and what else is going on in a student's life. Next slide, please. And so here are some lessons learned from us doing this kind of work. Number one, engage youth in development of the strategies, cultivate youth-friendly climate that can remove the barriers to learning, create opportunities for youth to get their social emotional needs met, because if you meet them there, they're open to learning. Educate and inform all school personnel about the impact of stress on learning, establish developmentally appropriate school policies and practices, promote a school-wide culture of caring, and then we want to build the relationships between the school-based health centers and the school staff. Like I said before, a lot of times they are operating completely separate, and so we want to help the school, the staff, the community, all to understand that we need to work together. Another was to get school leadership buy-in and involvement. So this is really transformative work. And so it requires equity in schools. In order to advance equity in school, it requires everyone to be on board. So our program activities were executed more seamlessly when the school principals and the district were involved. And I have lots of stories where we have done some remarkable work when you really have everyone that gets it and they understand the value. We also want to prioritize support for staff, health and well-being. So, when you go on an airplane, there's that graphic where it says, put your mask on first before you put on this person's mask next to you, because you also have to practice self-care. And, often in, as I said, under-resourced communities, that's not limited. The stress and all of that is not limited to the students. So you have to make self-care a priority among all the participants, both student level, staff level, community level. And then finally, multi-sector partnerships are fundamental for this type of systems change work, and in order for it to be sustained. So it takes time to actualize this type of work, particularly when we're trying to change policies. And so we've learned that when you're building cross-sector and collaborative partnerships, it really goes a long way. And we've worked to help facilitate those type of partnerships between schools and external partners. And that's really a priority of our focus. Next slide, please. So this comes to the end of my presentation. I was only able to touch the surface, but if you wanted more information, please visit www.schoolbasedhealthcare.org. The pictures on the slides to the right are 4 briefs that go more in depth into this work. We are also going to be releasing a 5-year impact report. You can find that on our website. Follow us on Twitter, sign up to receive our newsletter. And my final slide. Next slide, please. Thanks again for the invitation, and I'm happy to take any questions, and feel free to contact me. My information's there, and my email is regina.davis@apha.org.
Thank you, Dr. Moss. The information you shared tonight is both essential and vital to the resource package of any educator. So again, thank you for sharing that information with us. And I also kind of want to but just kind of reference one of the graphics that was in your presentation that spoke to tackling inequities and the baggage that students can come to school with. So one of my very favorite people, her name is Shalonda Soroya. She's watching, and she made the comment that the teacher, even in the graphic, appeared unbothered by that environment. So how often do we encounter, situations where there's just total chaos, and then the adult or the professional does not involve themselves? And so again, thank you for sharing this information with us. And we know that the information that we gather tonight is important to support the students. It's essential that we have a significant and a strategic plan of action, not just any plan, but a strategic one for those that we serve. So again, thank you for that. Thank you, Dr. Moss. Now, everybody, it is BYOB time. Bring your own voice. This is the part of the show where you guys have the opportunity to ask our guest panelists any question that you would like to ask them. Go ahead and place your comments, your questions in the comments section, and we will be sure to make sure that Dr. Moss gets those questions and provides responses. And so we'll go ahead and start with our first question, Dr. Moss. It says, what does a typical school look like that APHA works with?
Well, thanks for that question. So yes, as I talked about, we've worked with schools all across the country, and they've been in Oregon, Nebraska, Connecticut, Florida, DC, Maryland. And I would say that they're not, so you heard the term dropout factory, which is about when less than 60% of the students drop out. Less than 60% of the students do not graduate. Mm-hmm. Am I saying that correctly? Only 60, yes. Sorry. It's 7:00 here in DC, forgive me, but y'all know what I'm talking about. So they're not quite dropout factories, but only about 70% of students graduate in 4 years. And about 90% of the students are receiving free and reduced lunch, and 91% identify as students of color. So that's what a typical school looks like. But I will say, as you all know, just because it's in a disadvantaged, quote unquote, marginalized community that has, it is all about the staff there, the teachers, the community. If you have a very invested, great administrative leadership, none of that really matters, because it's all about the heart and the commitment.
Absolutely. I completely agree with that response. Okay, thank you. And we have another question. How should educators shift their mindset to see these things even in this virtual setting?
So I tell people lots of time when I give this talk, for some reason, the light bulb comes out when we say, well, have you ever asked your students, do they have running water, or do they have electricity? A lot of times when we think about health, we think about things like vision, or sometimes we think about hunger, but we don't think about those other things. And so I think, sometimes it's different things to shift a mindset, but sometimes for me, you cannot refute the data. So if you can, schools are already doing a lot of assessments. Mm-hmm. When you're assessing your students, sometimes they're required by state, but try to, get your hands on that data and try to start looking at that data in a different way. And then, if you are a believer of this, you be the one to go in and try to start having those conversations and saying, okay, no, let's think about it this way. We also work with schools I don't know if you heard of RAPS, which is a school-wide assessment, but we work with schools to try to include a few more questions into their RAPS assessments if they're already doing it. And we call it RAPS Public Health. And it's really for middle and high school students, but it assesses some of those things like poverty or emotional behavior issues, and it was asking things like, have you considered suicide, or all those things that can impact absenteeism and poor health.
Okay, so would you say adjusting our lenses as educators during this virtual settings, adjusting our lenses to be more aware, provide more awareness of what could actually be going on with our students in their homes?
Yes, I apologize. I didn't get to the end part.
You're fine.
Right. Yes. So yes, adjusting your lenses. I guess that would be literally too, because you're going to be watching virtually. So, you can, see when a student is not engaged. And one of the things that has been highlighted through this is that a lot of times school was a safe haven for some of these students. And so now they're not even getting that respite. So, just try to be cognizant and try to be a little more mindful of what's might be happening there. And, I think they call it the now coronavirus for a reason, because nobody knows,
right?
We're all learning. And so we're all going to have to be creative. Yes. But those issues, as don't go away just because we're learning virtually. So, when they're coming to school, hopefully, a lot of jurisdictions are still offering free and reduced lunch.
Yeah.
So when they're coming to school, try to be that caring adult, that face that if they need to confide in you in that short amount of time, they can do that.
Absolutely. Thank you. Okay, we do have, it's a question from, again, one of my favorite people. Do you work with any schools on reservations, and they have some of the most severe issues ever? So do you work with any schools on reservations?
Yes, we have worked with schools. We had, as I was saying, for the last 5 years, had a cohort where we were actually working with administrators, school-based health center, providers, community members, and they represented any and all type of populations in schools.
So, okay. Thank you for that response. I think we have a couple of more questions. Is there a current partnership with specific DC schools or the district public school?
There is not currently one with DC. We did previously work in DC, let's see, maybe 2 years ago, and it was actually part of the in-service training for teachers, but we are not currently working with DC.
And so in order to make that connection with the agency now, what could one do?
Well, I'm in DC, so just call me. If you need me to come to your school, I'll come. My staff and I will be happy to come talk to you at your school.
Okay, all right. Let's make sure. So what resources, then this question comes from Ashley Kearney. What resources or texts would you suggest to better understand age-appropriate responses?
So now I am not a psychologist. I am a health behavioralist. So definitely that's hopefully your resource with counselors. That is where I would be leaning on them with regard to coping and those sort of interventions. I can definitely point you to some resources if you want to email me offline as to, some specific programming with regard to that. But in terms of individual interventions, that's where I would be looking to my counseling and resource staff.
Gotcha. Thank you for that too. Okay, so if you're looking for those resources, connect with Dr. Moss. Her information will be available. This is our last question. What are some things that viewers can do?
Okay, so like I said, the squeaky wheel gets the oil. So you have to be vocal. We have to let people know, particularly, I think we are in a time of reckoning right now where we are seeing change, being more vocal about our change. We are raising awareness about the inequities that we're seeing. And so I think, being an advocate for sure. And then I talked about those caring adults. So those positive relationship. And so what I'm saying, what we can do individually here, positive adult relationships are critical for health and well-being. So trying to build those strong relationships and strong bonds with students. So, trying to, whether that be doing that through local programs or actually coming into school and creating opportunities, or even creating mentor programs. And then really just working to try to reframe school dropout as a public health issue, or not even public health, just as a health issue. Because if you can help your elected official understand that, you can help parents understand that, you can help civil rights groups understand that, and they understand that how it impacts dropout, and then how that is so central to the community, to the health of the community, then there's definitely going to be more ears listening to this type of work.
Absolutely. So again, guys, you heard the response. Relationships, building relationships, mentorships. I saw comments popping up. There's power in our voices. Be vocal. Be vocal. Well, again, thank you, Dr. Moss. I'm going to bring Simone in. Thank you.
Dr. Moss, on behalf of the L.I.V.E team, we want to say thank you so much. This is an amazing presentation. It gave us a lot of things to think about. And so on behalf of the L.I.V.E team, we want to say thank you for being a presenter for the L.I.V.E summer program sessions. And we appreciate you very, very much.
Thank you.
You are welcome. Please stay tuned. Stay in the background. Keishla is going to end us out. Thank you so much.
All right, guys. All right. Well, again, we want to thank Dr. Moss for joining us this evening. We also would like to get your feedback. So if you would, grab the link from the comment section, fill out the survey that is associated with the link. Once you fill out that survey, it not only provides us feedback, but it provides you an opportunity to win a Visa gift card. In fact, we're going to go ahead and draw names from those individuals who filled out the survey this past Tuesday. So let's see who our first winner is. Our first winner is Krista Glover. Y'all, Krista actually won Tuesday also. So, all right, Krista, congratulations. And our next winner is Karen Williams. Congratulations, Karen, and congratulations, Krista. Back to you, Simone. Tag your it.
Hey, guys, listen, we're going to bring the team back so we can say goodbye, but then I'm going to share with you who's going to be up next week with us. And so we really excited. Next week, it's going to be us. We're going to be doing some of the live lessons learned. Miss Yolanda, make sure you are here because Keishla already told you you're her favorite person. So she knows.
Right.
Right. So next week, please stay tuned to what we're going to do. And then Thursday, we have Dr. Denise Harrington is going to be up. And so we appreciate all you guys tuning in tonight. Have an amazing night. God bless you all. And we will see you guys back on Tuesday. See ya.
We got to fight against them, but we need numbers. We need to show up at school board meetings. We need to show up at county commissioner meetings. We need to have someone on the agenda to talk and know what they're talking about to advocate.
great if you're not being better than you were tomorrow than you were yesterday. So that's the whole goal, just to be better, to come with the new knowledge, come with the new awareness,